Hey everyone! Whether you're a brand new grad or a seasoned nurse, interviews can still be nerve-wracking. But don't worry, I've got tips to help you walk in with confidence and walk out with that job offer. To highlight your clinical judgment, empathy, and teamwork, it is very essential for a standout interview. Excelling in your interview is essential to showcasing your skills and securing the right role. Common nursing interview questions cover your background, professional goals, and how you handle stress, teamwork, and difficult situations, often using behavioral questions like, "Tell me about a time yourself." For new graduates, questions focus on your clinical skills, how you've applied your education, and why you chose nursing. For experienced nurses, questions will involve leadership, conflict resolution, and adapting to change. New and experienced nurses are often asked about clinical judgment, teamwork, communication, and patient advocacy. The key difference is depth. New grads focus on potential and learning, while experienced nurses highlight leadership and impact. Here's a breakdown of common interview questions tailored to both groups, with examples to help you prepare. If the interviewer asks, "How do you assess reported pain without visible signs?" You can say, "I trust the patient's report. I use the PQRST method to assess pain, observe cues, document findings, treat accordingly, and reassess to ensure effective care." You can use this in an interview to show your clinical reasoning and patient-centered approach. Don't answer like this. "If they don't look in pain, they're drug-seeking, I just wait." These kind of statement is not only inappropriate, it undermines patient-centered care. Next, if an interviewer asks, "How do you handle family questioning about pain management?" How should you answer? You can say, "I understand your concern. Here's my assessment, your current score, and the plan moving forward. Let's align our goals to ensure the best outcome." This phrasing shows empathy, clinical clarity, and a collaborative mindset, perfect for patient interactions or interview scenarios. Do not answer like this. "Families don't get it, they should trust me." These phrasing can come across as dismissive. If an interviewer asks you, "How do you address a colleague skipping hand hygiene?" How would you answer? You can say, "I'll remind them now. If the behavior continues, I'll address it privately, notify the charge nurse, and document the incident appropriately." This shows leadership, accountability, and respect for protocol, all excellent qualities to highlight in a nursing interview or clinical setting. Do not answer like this. "That's not my job. Everyone is busy." Exactly. That kind of response can come across as dismissive and unprofessional. Next, if the interviewer asks you, "A patient refuses prescribed medication." How do you respond? You can say this, "I'll ask why, explain the purpose and potential risks, offer alternatives if available, document the refusal, and inform the care team to ensure continuity and safety." This response shows respect for patient autonomy while maintaining clinical accountability, a great phrase to use in interviews or real-world scenarios. However, do not say this. "They must take it. It's ordered. I'll note noncompliance." That kind of phrasing dismisses patient autonomy and can damage trust. If an interviewer asks you this, "How do you prioritize care for multiple critical patients?" You can say this, "I prioritize the ABCs, treat life-threatening issues first, delegate tasks appropriately, communicate the care plan clearly, and reassess to ensure stability and progress." This phrasing demonstrates clinical judgment, leadership, and a structured approach to emergency care, perfect for interviews or real-time decision-making. However, do not say this, "I just work as fast as I can and hope to reach everyone." That kind of response lacks structure and accountability. Another scenario when asks, "How do you respond to a discovered medication error?" You can answer by saying this, "I assess the patient, notify the physician and charge nurse, report findings, monitor closely, and document thoroughly to ensure safe and coordinated care." This phrasing highlights your clinical judgment, communication, and accountability, perfect for interviews or real-time decision-making. However, do not say this, "I'll continue care and hope nothing happens." That kind of response lacks clinical accountability and proactive thinking. Next, if the interviewer asks you this, "How do you manage agitation in a dementia patient?" The best answer would be, "I stay calm, Validate the patient's feelings, use distraction techniques or familiar items to provide comfort, and always preserve their dignity throughout the interaction. This phrasing reflects emotional intelligence, trauma-informed care, and a patient-centered approach, perfect for interviews or real-world scenarios. However, do not answer, "I'll rush the care" or be firm to force cooperation. That approach risks compromising both safety and trust. Next, when an interviewer asks, "You witness a patient fall. What's your step-by-step response?" You best answer, "I'll stay with the patient, perform an immediate assessment, call for help if needed, notify the team, and document the event thoroughly." This phrasing demonstrates calm under pressure, clinical judgment, and accountability, all key qualities to highlight in interviews or emergency scenarios. Do not answer, "Help them up and document a minor fall." That response overlooks critical safety and accountability. Next, if they asks, "How do you challenge a potentially harmful physician order?" The ideal answer, you say, "I clarify the concern using SBAR, share relevant evidence, suggest safe and appropriate options, and escalate to the appropriate team member if needed." This phrasing shows structured communication, clinical reasoning, and accountability, perfect for interviews or real-world advocacy. However, do not answer, "I follow orders without question. Doctors know best." That kind of response undermines nursing autonomy and critical thinking. Next question, how do you answer? "What immediate steps do you take for sudden deterioration?" The best answer to this question is, "I perform a primary survey, call the rapid response team, act quickly to stabilize the patient, and communicate clearly using SBAR to ensure coordinated care." This phrasing highlights clinical urgency, structured communication, and teamwork, perfect for interviews or emergency scenarios. However, do not answer by saying, "I'll continue routine care and check later." That phrase can sound passive or vague in an interview, especially when you're aiming to demonstrate clinical judgment, accountability, and patient-centered care. And the last question on our list, how do you proceed when vitals contradict appearance? And the best answer is, "I would recheck the patient, reassess their condition, review potential causes, notify the healthcare team, and document all findings and actions taken." That phrasing is clear, proactive, and clinically sound. Do not answer, assume the monitor is wrong, and leave it. Absolutely. That phrase undermines patient safety and clinical accountability. In an interview, you want to show that you respond to abnormal findings with critical thinking and action. In nursing interviews, the ability to communicate with clarity, empathy, and structure is just as vital as demonstrating clinical competence. The words we choose and how we organize our responses reflect not only our knowledge, but our judgment, professionalism, and patient-centered values. Delivering short, focused responses demonstrates not only clarity of thought, but sound clinical judgment. Clarity reflects critical thinking. Brevity shows you can prioritize what matters. Together, they signal confidence, clinical judgment, and leadership. Thank you for watching. I hope you learned something new, and I know you've got what it takes to crush your next interview. If you found this helpful, don't forget to like the video and subscribe for more nursing tips.